After over a decade of promises, President Trump finally released his health care plan. What's in it and how will it affect you? Charles Gapa from acasignups.net has the details. Welcome to Care Talk Live, where we talk about how healthcare works or doesn't work in America and get you answers. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please text or call in your health insurance and healthcare questions at 202-838-6837, and our experts will answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get future Care Talk shows. In today's episode, we're talking about the new Trump healthcare plan and how it will affect you. So welcome, Charles, the founder of acasignups.net, a healthcare policy website.
Thanks for having me again. Good to talk to you.
So, at long last, over a decade since then candidate Trump had promised a great healthcare plan, we have something. So, tell us more about this plan or concept of a plan.
Sure. So basically, as I'm sure you and your viewers know, a lot of this came up because, of course, the big controversy and battle over the now expired enhanced tax credits for the Affordable Care Act. And so a few weeks ago, President Trump released what he calls the great healthcare plan, the greatest healthcare plan, whatever. And so if you take a look at it, and it's basically, it's not so much. Right off the bat, for example, he talks about that it's going to slash the cost of prescription drugs by 300, 400, or 500%, which is not mathematically possible. You cannot cut the price of something by more than 100%, unless they're talking about the pharmaceutical companies paying the patients to take their medication, which I'm pretty sure is not what's going to happen. But in terms of the actual provisions of the plan, it's really not a plan. It's really not. I wouldn't even call it a concept of a plan. It's basically a mishmash of oddball bits and pieces of ideas from a variety of sources. I can go through them, but it's essentially just sort of a smattering, is what I would call it.
Well, let's talk about those pieces,
Okay.
since people may be hearing about this or they may be hearing about pieces of it. What's actually in the plan, and what do you think is good and what is not so good?
Sure. So I'm just going to go through here. So the first provision, according to the White House website, is that it would codify the Trump administration's most favored nation deals to get Americans the same low prices for prescription drugs that people in other countries pay. That's what he's claiming. He uses an example of this as the reduction in cost of insulin to the $35 per month cap for Medicare enrollees, except that that's something that was actually done under the Biden administration as part of the Inflation Reduction Act, I believe. So that's a great idea, except that it's already been done for the example that he gave. And for other drugs, it doesn't have any actual teeth, any enforcement mechanism. It's basically just says we would get the same prices as other countries, but there's no way to ensure that actually happens. No specifics, no enforcement, no immediate effect. Basically, him just saying it shall be so. And in fact, just on New Year's Eve, there was a story out of Reuters that drug makers plan on raising U.S. prices on at least 350 branded medications. This was about a week or so after Trump had a big powwow with them, in which he claimed a big meeting with them, in which he claimed that they were going to be reducing prices. So it's basically sort of a meaningless claim. Also on pharmaceutical drugs, he claimed that it would make more of them available for over-the-counter purchase, which presumably would, reduce the cost. And according to Meryl Guzner, he's a healthcare expert, he says that this would basically be limited to maybe some different types of antacids or pain relievers, a few drugs here and there that aren't currently over the counter, but it really wouldn't have any major impact on the vast majority of more expensive medications. So it might save a few bucks here and there, but that's about it. Has nothing to do with like biosimilars, biotech, specialty drugs, that sort of thing would not be included with this. Probably the most significant, I'd say, provision of the so-called Great Healthcare Plan is that it would, quote, stop sending big insurance companies billions of taxpayer-funded subsidy payments and instead send the money directly to Americans to allow them to buy health insurance of their choice. Now, there's a lot of detail missing from that. It's a little hard to parse what exactly that would mean. I'm not sure if he's talking about the main ACA subsidies or the enhanced subsidies which just expired, or both. I'm not sure what he's talking about in terms of making it sending it to people to allow them to buy health insurance. So he doesn't want to give billions of dollars to the insurance companies. He wants to give it to people to use to buy insurance from the same insurance companies. So basically, the money would still be going to the insurance companies. So you might be asking, well, then what's the point? I'm not sure, but what it sounds like is that last bit where he says to buy the insurance of their choice. And what I suspect that means is that the idea is that you would use the money to buy non-ACA compliant insurance, otherwise known as, sometimes it's called short-term insurance, sometimes it's called association plan. There's different names for it. But basically what's colloquially referred to as junk plans, essentially insurance policies which don't comply with some or possibly any of the ACA requirements about things like guaranteed issue, community rating, actually having to cover, surgery, hospitalization, and other essential health payer benefits. Basically, all of the ACA's requirements. It sounds like the idea is that basically just give people a bunch of money to buy junk insurance that may not cover anything. That's the most. If that's what he's talking about, then that's basically talking about essentially killing the ACA altogether and returning us to the pre-ACA world where you can be denied coverage if you have a pre-existing condition. You can be charged many times more for different medical conditions, or because you're a woman, or for any other reason that insurance company sees fit, and so on. So that's if that's what he's talking about, that would be the most definitely the most significant provision of this so-called plan. But I'm not sure if that's what he's talking about because there are no details beyond that, really.
Right. I mean, I think one thing that everyone can agree on is that Donald Trump is not a policy wonk, that he is a slogan man. It's well known that Trump won't read more than one piece of paper. So he knows some things like Americans hate insurance companies, and he's rolling with that. But if this plan's idea is instead of paying insurance companies, pay people so they then pay insurance companies, like you said, that's kind of missing the point there. And what this plan does not include is anything to actually lower the cost of healthcare, which is mainly driven by prescription drugs and hospitals and doctors, expensive stuff. This doesn't lower those costs. So what it does is try to encourage people to have junk insurance, cheaper insurance. It doesn't cover anything because that costs less. So how come with over a decade to work on this, Trump and Republicans don't have an actual health insurance plan that makes it so that every American can get the coverage and the care that they need?
Well, the reality is, in a lot of ways, the ACA kind of is the what a prior generation of Republicans, shall we say, it kind of is in some ways what they would consider a a so-called market-based healthcare plan. It's basically about as conservative as you can get to comply with what they historically have envisioned as a market-based plan, where you have where you have competition on the marketplace, and you compare and contrast different policies and shop around and all that sort of thing. It's about as close as you can get to that. So there's really nowhere else for them to go from, for that. So they've sort of backed themselves into a corner, in my view. And if you go to the opposite of extreme, or the opposite end of the pendulum would, of course, be something like some sort of a single payer, universal healthcare type of system. And obviously, they don't want to do that. So instead, they're going with this weird discussions about health savings accounts and giving money to the people and then asking them to negotiate. Not necessarily Trump himself, but I know a lot of the Republican congressional members have been talking about, giving people money so that they can negotiate their pricing themselves. Which defeats the entire point of insurance. The entire point of any sort of insurance is shared risk. If you go to your doctor and you negotiate with them how much your surgery is going to cost, I guarantee you that you're going to be paying a whole lot more in most cases. Not to mention, most people don't have the slightest idea, how much, what would be a reasonable price in the first place. So, yeah, it's kind of a strange position that they're taking, because I'm not sure that they know themselves. So, having said that, there is one provision that actually would reduce healthcare premiums for some enrollees. And he's talked about this several times about funding the cost sharing reduction reimbursement payments, the CSR payments. If that were to happen, then there are several 100,000 ACA enrollees who probably would see their premiums get knocked down by about 10% or so. However, in the process, this would actually increase premiums dramatically for about 5 or 6 million other ACA enrollees who earn less. So it's basically just a trade-off where some people would save a little bit of money and other people would pay a whole lot more. So, yeah, and there's a couple of other odds and ends regarding things like pricing transparency and things like that. But most of that, again, is already the law. The ACA already requires things like health insurance companies have to post and they have to publicly publish their rate coverage pricing, so people know how much is going towards overhead and profit margins, things like that. And he also includes one rather curious transparency requirement regarding hospitals to be more transparent about their pricing, like publishing it on their website and such, which is not a bad idea, except that it's also already the law, or it's already a policy, and it's policy that's been in place since the first Trump administration. He was actually the one who put that in back during Trump 1.0. So he's basically just saying, well, we should do that, except that we kind of already are. So, So yeah.
Yeah, it seems to me that one thing that President Trump and the Republican Party in general have not really grappled with is that people with expensive medical conditions need expensive care. And so one thing you can do to make health insurance cheaper is throw everybody with expensive medical conditions to the wolves. Like you said, opening back up a junk insurance plans and letting healthy people leave the market and get something cheap because they theoretically won't need it. But there's nothing in this plan to help people that need to keep their health insurance, and that healthcare is expensive. Like you said, good luck negotiating your surgery and having that be anything affordable. I had 2 hospital stays the year that I was diagnosed with cancer, and each hospital stay was over $100,000. My insurance covered almost all of that, although I did hit my out-of-pocket maximum. But that's the thing. Say I'm a great negotiator while I'm dealing with fighting cancer, and I get them to go from $100,000 to a $90,000 bill.
Right.
Care is expensive, and we have not solved that problem.
Yeah, I mean, that's what it boils down to, is that generally speaking, the universal 80-20 rule very much applies in healthcare. which is to say that in any large group, large population, on average, around 20% of the population will generally utilize around 80% of the the healthcare, the medical expenses, and such. And around 5% of the population usually eats up about half of it. So yeah, in theory, as you say, if you were willing to literally basically just wipe out the 20% sickest people in the world, in the country, then guess what? Look at that! You've miraculously reduced the cost of healthcare by 80% or something. Of course, that would also involve murdering millions of people. And so, unless that's what you're proposing, and I hope they're not. Yeah, healthcare is going to be expensive. There are certainly ways of reducing costs here and there, but nothing in this plan would it would basically just shuffle the numbers around a little bit here and there. And beyond that, it really wouldn't accomplish much.
Mhm. Well, thanks for taking a stab at explaining the Trump healthcare plan, Charles.
Sure.
And now we're going to answer some of our audience's health insurance questions. Let's start by welcoming Diane Archer, the founder of Just Care and senior advisor on Medicare to Social Security Works. So, Diane, let's start with Medicare open enrollment is still going on right now. What do people need to know and do?
A great question. So it's Medicare Advantage open enrollment that's going on through the end of March. So as of now, you have about 2 months to look really hard at your Medicare options. If you're in a Medicare Advantage plan, a plan that's administered by a corporate health insurance company. And I would suggest that if you are in one of these plans, that you absolutely should take the time to dig deeper into what you have in the plan. You should keep in mind that in a Medicare Advantage plan, you have no way to know whether you'll be able to see the specialist you want to see when you are ultimately diagnosed with a complex condition. There is a network. The directory is often not accurate. And often the network is limited and may prevent you from using a cancer center of excellence, for example. If you have a rare cancer, that's certainly what you want to do, and you may not be covered for that care. So in many cases, people gamble with their health and their life in Medicare Advantage. So long as you're healthy, so long as you're doing well, you're fine, but you are gambling. You could also face long delays and denials of care that your treating physician and you believe you need. Unfortunately, again, you can't know ahead of time whether the insurer is going to agree with your treating physician or overrule that treating physician and say, oh no, you don't need that care, you can have less care, or let's wait and see and not do any care. And that the problem there is that insurers lose money every time they cover your care. They have to spend money that they otherwise would be able to put into their profits. So they have a financial incentive to keep you from getting that care for as long as possible. So you can look at your Medicare Advantage options, and you will have few, if any, upfront costs in Medicare Advantage, but you'll be taking this gamble. And I wish I could tell you that the 4 and 5 star plans would serve you well. I can tell you that the 1, 2, and 3 star Medicare Advantage plans will not, but the 4 and 5 star plans also engage at times in inappropriate delays and denials of care, which you want to avoid. Only traditional Medicare will cover your care from most physicians and hospitals anywhere in the country, and you won't have to deal with prior authorization delays and denials in most cases. So there's tremendous value in switching to traditional Medicare. The problem for many people, though, is that there are upfront costs. You need supplemental coverage to protect yourself. If you have Medicaid or a Medicare savings program, sometimes you won't need the supplemental coverage. You'll have the Medicaid to do that for you. But most people will have to pay for it. And that will take a bunch of money. So you're taking a gamble in traditional Medicare, not with the care you'll get. You'll get the care you need, but you will have to pay money upfront to protect yourself from financial risk. And if you don't, then you're gambling with your finances.
Thank you, Diane. Our audience may well know that open enrollment for the Affordable Care Act has ended in most states, most but not all. It's now the beginning of February. So, to talk about that and what people can or should be doing to get covered, welcome to Louise Norris, the Health Insurance and Healthcare Reform Analyst at healthinsurance.org. So, welcome, Louise.
Thanks, Laura. Yes, so open enrollment for marketplace plans has ended almost everywhere. There were several state-run marketplaces that extended it through January 31st, but that has passed. The one exception is Washington, D.C. D.C. does run its own marketplace, and they did a last-minute extension through February 4th. So you have until midnight on Wednesday, February 4th, to sign up for coverage if you're in Washington, D.C. There are some, like, for example, Connecticut debuted some new state-based subsidies, some state-funded subsidies for 2026, specifically for folks who earn less than 200% of the poverty level or between 400 and 500% of the poverty level. And they have opened a special enrollment period for folks who are eligible for those subsidies. So if you're in Connecticut, you can check and see if you're eligible for those subsidies, if you can enroll now. There are some income-based programs, some other income-based programs in Connecticut and Massachusetts that have year-round enrollment, so you can check and see if you're eligible. There are programs in Washington, D.C., Minnesota, New York, and Oregon for folks with income up to 200% of the poverty level. In New York, it's actually 250. Those are also year-round. So depending on where you live, you may have access to year-round coverage. Year-round enrollment is also available to American Indians and Alaska Natives. Medicaid enrollment is year-round, so it doesn't necessarily mean you can't enroll. It depends on what you're eligible for. But for the most part, if you're enrolling in marketplace coverage in most states, you do now need a qualifying life event that will trigger a special enrollment period.
Thanks, Louise. And going back to the main topic of the show today, which was Trump's long rumored, finally sort of delivered healthcare plan. Do you have any thoughts on what the Trump administration released and what it could or could not do for the people listening at home?
Well, I agree with Charles's take. I think it remains to be seen whether any of that would actually come to fruition as legislative policy. I think what people are really concerned about right now, as far as folks who buy their own marketplace coverage, are the premium increases that we saw for 2026. And, Trump's proposal doesn't do anything to mitigate that. The Senate has not taken up the measure that the House passed to extend those subsidy enhancements that expired at the end of 2025. There are some bipartisan compromise bills floating around, but nothing has really happened. So I think that is a really big issue that's facing people right now. And unfortunately, Congress has not. The House did pass a measure to address that, but the Senate has not, and the Trump administration has not done anything to address that issue, unfortunately.
Yeah. So sadly, many people are facing higher health insurance. And as we've talked about before on previous shows, cutting money out of our healthcare system trickles down to everybody. So even people with employer insurance or people, Medicare had to raise their rates, and Medicaid, like wherever you get your health insurance, you are paying more because this money was taken out of the system. And we haven't even seen the Medicaid cuts really go into effect yet, because that's happening next year. So given all of that, do you have any thoughts for people right now who are facing the reality of not being able to afford their health insurance plan?
That is a very tough situation for sure, and there are a lot of folks who are in that boat. I think if your coverage auto renewed for, and this is talking about folks with marketplace coverage, because they're the ones who saw the biggest spikes in their premiums. Obviously, yes, people on Medicare, people on employer-sponsored insurance also saw increases, but the marketplace increases were particularly large. If your coverage was auto-renewed and you are struggling to pay the premiums, I do think it is important for people to know that if you're on a bronze plan and you contribute to a health savings account, because all bronze marketplace plans make you eligible for a health savings account this year, you don't have to make the contribution now. You just have to do it sometime before April of next year, before April 15th of next year. The amount you contribute to that health savings account will lower your income for the calculation that the marketplace uses to determine whether you're subsidy eligible. And that could, for some folks, be enough to get them under the subsidy cliff where they could qualify for subsidies. Also know that contributions to a retirement plan will do the same thing. If you contribute to an IRA or a SEP IRA or a solo 401k, something like that, those are as long as it's not a Roth, if they're pre-tax contributions, those will also lower your income. So just looking for ways to get yourself eligible for that subsidy if your premium has just become unwieldy, and know that you can contact the marketplace at any time to update your income. So if you do make one of those changes and it lowers your income, you can contact the marketplace and they'll change your subsidy in real time. You may have to provide proof of the income change, but that's a tactic folks can do.
Do you want to give people a warning if they see anything from a health sharing ministry? We want to talk about how that is not insurance, and people should not like the ways that people can be scammed because they can't afford Affordable Care Act health insurance and are looking at alternatives.
Absolutely. And that has always been an issue, but it's especially an issue this year because people are facing this new affordability issue that really wasn't a problem for the last 5 years. So the non-ACA compliant sort of alternatives for health insurance have always been around. But yes, it is definitely more that
Looks like we lost Louise there, but health sharing ministries are not health insurance. They may promise to pay a expensive healthcare bill if you have them, but they are not regulated by your state insurance bureau and so on. They are not required to pay out the care that you need. And so you could be left in the lurch if you are using these ministries that, again, are not health insurance. Short-term and association plans are actually insurance, but they can have underwriting requirements, which means they can refuse to cover you if you have pre-existing conditions. They can refuse to cover the care that your pre-existing condition needs. They can also have riders, like refusing to cover pregnancy, childbirth, cancer care. There are all kinds of requirements that can be in these short-term and association plans that, again, are why they are sometimes called junk plans, because they're not a very good value. They're not required to pay out certain amounts of money on health insurance. So that's where we're at, unfortunately. We're facing all of these bad alternatives because Congress refused to act and make health insurance more affordable. So thank you for joining us to learn more about the new Trump health plan and how it could affect you if any of these pieces of the plan are actually become law. Please text or call in your health insurance and healthcare questions at 202-838-6837, and we'll answer them in future episodes. Join us in the future for more on healthcare in America. Be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.